Often the clinical features obtained from history and examination alone will be sufficient to establish the diagnosis. A full blood count should be taken in heavy menstrual bleed and severe anemia. HMB invariably indicates the presence of significant fibroids. Abdominal ultrasound or transvaginal ultrasound is the mainstay of diagnosis and helps delineate the origin of a clinically detected pelvic, that is, distinguishing between a uterine fibroid and an ovarian tumor and locating the position and size of fibroid. In the presence of large fibroid, ultrasonography is also helpful to exclude hydronephrosis from pressure on the ureters. भाई अगर फाइब्रॉइड इतना बड़ा इसने यूरेटर पे प्रेशर डाल दिया तो फिर तो हाइड्रोनेफ्रोसिस भी हो जाएगी. एमआरआई इज ओकेजनली यूज टू डिमार्केट द मोर्फोलॉजी साइज एंड लोकेशन ऑफ यूट्राइन फाइब्रॉइड प्रायर टू रेडियोलॉजिकल और सर्जिकल इंटरवेंशन. Useful tests where uterine fibroids are suspected. Transvaginal, good for detecting and locating submucous fibroids and small intramural fibroids. Transabdominal, good for detecting larger intramural and subserosal fibroid and excluding hydronephrosis secondary to pressure from fibroid obstructing the ureters. Good for detecting and locating submucosal fibroids and endometrial polyps. Hysteroscopy, good for detecting submucosal fibroids and endometrial polyps. Good for planning subsequent hysteroscopic surgical treatment. Surgical hysteroscopy can remove polyps, adhesion and submucosal fibroid. MRI is good for describing morphology location of fibroids, indicating prior to uterine artery embolization तो नहीं करना अगर आपको, और ट्रीटमेंट का रिस्पॉन्स अगर देखना है. कंजर्वेटिव मैनेजमेंट इज अप्रोप्रिएट where asymptomatic fibroid detected incidentally. The main types of medical treatment for heavy menstrual bleeding, ये सब करनी है जो ट्रीटमेंट है, मेफेनेमिक एसिड कंबाइंड ओसीपी टेंड टू बी इनइफेक्टिव इन द प्रेजेंस ऑफ सम म्यूकस फाइब्रोइड और एन लार्ज यूट्रस दैट इज palpable abdominally more than 12 week size. The only effective medical treatment is the use of injectable gonadotropin releasing hormone agonists which induce a menopausal state by shutting down ovarian estradiol production. However, GnRH treatment is not tolerated by all women because of severe menopausal symptoms. More recently, the selective progesterone receptor modulator ulipristal acetate has been shown to be as effective as GnRH agonists in reducing fibroid volume and elevating heavy menstrual symptoms, although it is not yet widely accepted into clinical practice. In addition to being an oral tablet, SRPM does not induce a menopausal state and associated symptoms. However, neither GnRH nor SRPM present a viable long-term treatment option. Moreover, when ovarian function returns, the fibroids regrow to their previous dimensions. Surgical treatment. The choice of surgical treatment is determined by the presenting complaint and the patient's aspiration for menstrual function and fertility. Minimally invasive hysteroscopic surgery can be used to cut away a submucosal fibroid or a fibroid polyp, helping to resolve heavy menstrual bleed symptoms even in the presence of other types of fibroid. अब मैं तुम्हें बताता हूँ पहले submucosal